Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about barium swallow. Barium swallow is the radiographic examination of the upper gastrointestinal tract. The barium swallow is performed to diagnose the structural and functional abnormalities of pharynx, esophagus and proximal stomach by using the barium sulfate contrast media. It may be performed as a single or double contrast study in the radiology department. The barium swallow examination may be performed by two methods. One is single contrast study and another one is double contrast study. In single contrast study, it is performed for the evaluation of esophageal motility disorders and luminal abnormalities. In double contrast study, it is performed for the evaluation of the mucosal details of the esophageal wall. This is how a barium swallow of the images looks like. Indication: dysphagia. Dysphagia is nothing but difficulty in swallowing, abdominal pain, blood and vomits, unexplained weight loss, hiatus hernia, esophageal carcinoma, esophageal ulcer and polyps, gastroesophageal reflux disease, diverticulum. Contraindication: recent gastric or esophageal surgery, tracheoesophageal fistula, esophageal perforation, suspected pregnancy, complete bowel obstruction. Patient preparation. No special preparation is required. Fasting may be employed for 2 hours prior to the examination. The patient is asked not to eat or drink before the procedure. The patient is instructed not to smoke or eat chewing gums because it prevents the proper coating of barium sulfate on the mucosa. Equipment: fluoroscopic unit with tilting table, attached image intensifier or a spot film device, high speed cassettes. The thin density of barium sulfate suspension for single contrast study, the thick density of barium sulfate suspension for double contrast study, effervescent powder which is gas producing agent for double contrast study. A procedure. On the day of the examination, the technologist should describe the whole procedure to the patient and obtain written consent from the patient for the permission of procedure. The patient is asked to remove clothing and wear a hospital gown. In single contrast study procedure, the patient is placed in an upright position, then the head is turned behind the fluoroscopic screen. Then the patient is instructed to take 10 to 15 ml barium sulfate, which is one mouthful, and swallow it. The passage of barium is examined by the radiologist under the fluoroscopy machine, and then the patient is asked to take several mouthfuls of barium sulfate and swallow it. During the swallowing, the radiologist observes the passage of barium under fluoroscopy screen, and if necessary, spot films are taken in anterior posterior projection, right posterior oblique projection and left posterior oblique projections. All exposure should be made in suspended respiration. Again, several mouthful of barium sulfate are given to the patient and full length of the films are taken through the spot film devices. The films are taken from the pharynx to the cardiac orifice of the stomach before the esophagus empties. This is how a single contrast study images looks like. Double contrast study. The patient is placed in the upright position, then an injection of hypotonic agent which is of buscopan or glucagon is given to the patient. After the injection, one mouthful of high density barium sulfate is given to the patient and asked to swallow. The passage of barium is examined by the radiologist under the fluoroscopy machine. After then, the effervescent powder is given with another mouthful of barium sulfate. The patient is instructed not to burp after swallowing the barium. The radiologist observes the passage of barium under fluoroscopy, and spot films are taken during adequate distension of the esophagus in anterior posterior projection, right posterior oblique projection and left posterior oblique projections. This is how a double contrast study images looks like. Aftercare. The patient is advised to increase the fluid intake to avoid constipation. Inform the patient about the feces will be whitish for 2 days. The patient will be allowed to leave the examination room once after the completion of the procedure. This is how the filming looks like. Special projection, hiatus hernia, gastroesophageal reflux disease, tracheoesophageal fistula, perforation or obstruction. Thank you.